Good afternoon, everyone. My name is Judy Blake, and I am a program coordinator for Family to Family Network, an amazing nonprofit organization in Houston, Texas. Thank you so much for joining us this afternoon as we discuss Medicaid buy-in and Medicaid buy-in for children overview. We are very pleased to have join with us today Ms. Lynn Humphrey with Health and Human Services. Before we get to that, I just want to introduce some of my amazing, incredible colleagues: Leslie Lawson, Christina Zavala.
Hello, good afternoon.
And Leonella Castillo, who's going to be forwarding the slides for us. Many thanks to you, Leonella.
Hello.
So this is going to be a series of training sessions that we are having. We will be having 2 sessions every month on different topics that are applicable for our families. The one right now is going to be in English. We are going to be having a session later today at 6 o'clock that is going to be in Spanish. Please check out our website, f2fn.org. Christina, if you could put that in the chat, that would be great. And you can sign up for future trainings. Just know that if you already have signed up for this training, you will get email reminders for every class that we have in this series. So you do not need to sign up again. But our website lists future topics, and we will always send you reminders. So if you could hold questions until the end, that would be great. Lynn Humphrey is going to be talking about Medicaid, and she's happy to answer any questions you may have. If you feel uncomfortable asking any questions, you can always private message any one of us at Family to Family Network, and we will ask your question anonymously. Lynn, thank you so much for joining us today. We truly appreciate your time and your expertise.
Thank you, and good morning. I'm sorry, it's afternoon. Good afternoon, everyone. So today we're going to talk about 2 programs, Medicaid buy-in, that's for adults that are working, some of our children actually work, so it's for anyone that's working. Medicaid buy-in is for children through the month of their 19th birthday. So we'll go ahead and start the next slide. So what is, I'm sorry, I bet you can hear me better now.
Now we can hear you much better. Yes, thank you.
So Medicaid buy-in, what is Medicaid buy-in? Medicaid buy-in, we call MBI, and it's a Medicaid program for working individuals with disabilities who earn more than the allowable limits for regular Medicaid. MBI offers Medicaid healthcare services, including community-based services and supports to individuals with disabilities who work. Individual must meet both a financial and non-financial test, and the eligible individuals may have to pay a monthly premium as a condition of eligibility. Next. So the non-financial requirements for eligibility is the individual of any age who A, has a disability, that's either through Social Security, or if you don't have a disability determination through Social Security, HHSC has a disability determination unit that will go over medical records and determine whether you have a valid disability. The person is working or earning income. This doesn't mean that they have to work 40 hours a week. Lots of our clients can't possibly work 40 hours a week, and some can. They just have to be working and earning income in each month. So if they work 1 day a week, that's fine. We just have to have them earning income each month. You must live in the state of Texas and be a U.S. citizen or meet the certain qualified alien status requirements, meaning you would have to have 40 quarters or be here on one of those other alien requirements, and that you do not live in a state institution or nursing home. Now, I've learned, though, that does not entail if they're in a group home setting where, um, Medicaid's not paying their rent and stuff like that. They're just going to pay to have help. Maybe they need help going to work and getting back home, whatever that looks like. Next, please. So for eligibility for the disability, an individual, I'm sorry, the individual must meet the Social Security Administration's SSA definition of a disability regardless of age, meaning you can be young or old. We don't do elderly disability. We don't go by just being over age 65. You actually have to have a disability. And they may already have an established disability determination by Social Security. And you must have a disability determination established by HHSC prior to an eligibility determination if they do not have one from SSA. Our disability determination unit, they follow the SSA guidelines for disability. So if we give you one, you pretty much would probably get one through Social Security. The only exception is individuals who are able to engage in substantial gainful activity may still meet the disability requirements. For instance, I have a client who is on RSDI. He's working 40 hours a week, loves it, doesn't care they're taking his Social Security away. So his denial for his RSDI through Social Security.
Lynn, can you please clarify what RSDI is for people?
Okay, so Social Security has two programs. RSDI, which is for those that are retirees, survivors, and disabled, and there's one more, and I can't think what the letter I is. But that's the one that you get after you've been disabled for 2 years or you are age 65. That's what we also refer to as Social Security retirement. So if you do get RSDI and the federal poverty limit is $973, and you get only $800 a month in your RSDI. So because you are not at the poverty level of $973, SSI is going to come in and give you Medicaid, and they're also going to give you a cash benefit, bringing you up to the current poverty level. So big difference between the two. RSDI does not automatically come with Medicare, but SSI does automatically come with Medicaid. So this gentleman, he was disabled and on RSDI, and he was working 40 hours a week, like I said, and Social Security determined that he now was not eligible for his RSDI anymore because he is able to engage in substantial gainful activity. We call that SGA. So if his denial for his RSDI is for SGA, we still give that client a disability because we require that they work to be in the program, so we can't deny them for working. So that's the only way to get past that if you're not on RSDI and they've taken your disability. So that's good for a lot of people that do want to work. I mean, they go to school, get degrees, and they want to work 40 hours a week. So we allow them to do that and still keep Medicaid to help them get through the day with whatever they need. Okay, next slide. So continuing the financial criteria, individuals must meet both an income and resource limit. So only the applicant's income and resources are considered when determining eligibility. Income must not be more than 250% of the federal poverty level. So for 2024, it's $3,138. Resources must not be more than the current resource limit for the Supplemental Social Security Income Program. That's SSI. That's the one that comes with Medicaid. Must not meet and exceed the 2,000 after allowable exclusions. So let's move forward and see what those are. So the gross earned income minus allowable exclusions are compared to the FPL, that's the federal poverty limit, when determining eligibility. So these are the allowable exclusions for MBI. We give them a $20 general deduction. They get a 65 plus 1/2 of the remaining earned income. Earned income and child tax credit payments. That's if they're being prepaid their child tax credit payments. We don't, we can actually exclude those because that's not income they earned. Disability related work expenses. Now, what are some of the disability related work expenses? It could be you might need someone to come help you get up in the morning and get dressed, get you to work. You may need someone at work to help you and assist you. If you are paying any of those out of pocket and the state of Texas and Medicaid are not paying those, then those are also considered disability related work expenses and we can deduct those. Next slide, please. So for resources, the MBI resource exclusions are retired related accounts. Those are IRAs, all those, good things. A plan to achieve self-support, which is PASS, and you would actually go to Social Security to apply for a PASS. So the plan to achieve self-support, you cannot have a degree. You cannot have a degree to be looked at for PASS. You have to have a plan to achieve self-support. So you need to, it's the criteria that Social Security requires where you give them, they discuss with you what your plan is to start being self-sufficient. And then the independence accounts, those are also, my mind just went blank. Those are the accounts where they're set up and they're to gain independence. I can't even think of it right now because I don't have my book in front of me. And then the general 3,000 MBI exclusion. So the cool thing about MBI is when you apply, and let's say you have $3,000 in the bank, okay, and you have $100 in cash. So when we look at your total resources, we see $3,100. So you get a general $3,000 MBI exclusion off the top. So we would take $3,000 from that, and your countable resource would be $100, and we would compare that to the $2,000 limit. Okay, so clients could still be eligible even if they do have a little bit of money, kind of saved up in their account. We don't want to punish them for that. Next slide, please. Eligible individuals may have to pay a monthly premium as a condition of eligibility. Monthly premiums are based on a sliding scale, are calculated using both earned and unearned income, and they may range from $0 to $500. So let's go next. I think they have some examples, and I just want to make sure before I start trying to explain. Okay, so let's go past this, and I know we have some examples, and we'll go over it. So the unearned income premium amount is based on the amount of unearned income that remains after subtracting the SSI federal benefit rate. So that is that current income limit for SSI we were talking about. The earned income premium amount is based on the gross earned income minus any mandatory payroll deduction. So that's net income. We take the gross amount they make and we take off the income tax, Social Security tax. That's the FICA, the Medicare tax, the Social Security tax, and then any retirement withholdings. For instance, if you work for the state of Texas, ERS takes a retirement withholding, and you have no choice in that. So that's a required retirement withholding. I also have a 401k, but I choose to be in that 401k. So that is not a required retirement withholding, and we cannot exclude that money. Okay, next slide. So our example one for unearned income premium. John gets $1,085 in RSDI and net earnings of $1,895 a month. So we're going to subtract the SSI federal benefit rate amount from the countable earned income. So In this example, his unearned income is $1,085 minus the federal benefit rate for SSI, which right now is not 973, it's 943. And then the unearned premium amount is $142. So this is John's unearned premium amount, which is 142. And we'll go next and we'll look at his earnings. So John's earned income premium amount, go back just, yes. John's earned income premium amount is based on his net earned income of $1,895 a month. We've already taken out his tax, his withholding, and all the other required exclusions. Go next. So this is the 2020, I don't know why this is still on there, but I need to change this obviously. The earned income premium amount. So for him, he was making $1,850 a month, correct? So if we look at the chart, he is making less than or equal to $1,883. So he would have a 0 MBI premium for his earned income. Go next, please. So I'm sorry, they have John with an earned income premium of 20 because they probably had the chart updated and I didn't update it in the slide. So he does have a $20 income premium, and then he has a $142 unearned income premium. So John's total premium is $162. And again, it's below the $500. So that would be his set premium that he would have to pay monthly for his benefits. And then example 2, Jane gets $1,498 in RSDI and net earnings of $1,580 a month. So in the example, we're going to take her unearned income, $1,498. We're going to minus the 943. Then she's going to have an unearned income premium of $555. Go next, please. So her earned income premium amount is based on her net earned income of $1,580. Next, please. Jane's earned income premium is 0 because she's under that $1,880. Jane's unearned income premium is $550. So Jane's total premium is actually $500. Note, total monthly premium cannot exceed the $500 threshold. Then now we're going to move to Medicaid buy-in for children. It's a little different. Actually, it's quite different. So Medicaid for children with disabilities with family income not more than the limit based on the family household size provides Medicaid benefits to eligible children with disabilities who are not eligible for SSI for reasons other than disability. Most of the time, they're not eligible for SSI because mom and dad make too much money. And then a family may have to pay a premium as a condition of eligibility for MBIC also. Let's go next.
Hey, Lynn.
Yes,
So
ma'am.
this is great information. I just know that it's going to be very, very confusing for families to absorb all of this. So I have a feeling you're going to get a lot of questions about, this is my situation. Do I qualify? Do I not? What should I do? Just so you know.
Okay. And that's fine. I'm going to give you my direct phone number and everything at the end of this presentation. Okay. Calling 211 isn't going to do you no good. And as the 3, that's my responsibility, is to make sure I'm handling all complaints and questions from our population.
Thank you.
You're no problem. So for the non-financial for Medicaid buy-in for children, the individual who is, it says 18 or younger, but actually now it's individuals who are up through their 19th birthday, the month of their 19th birthday. So for instance, little Johnny's birthday is March 25th. He will get benefits through that whole month. It doesn't matter if little Johnny's birthday is March 1st. He gets the entire month of his 19th birthday. They have to have a disability. And again, if the child doesn't have an SSA disability, we can take medical records and establish a disability through HHSC. They must not be married. Again, they live in Texas and a U.S. citizen and meet certain qualified alien status requirements. And they do not live in a state institution or nursing home. Next slide, please. So in addition to the non-financial criteria, the children must meet income limits for the program. We have no resource test for MBIC. Most children don't have any resource. They may have a little savings account or something, but most children, because they're under 18, they can't get anything in their name. So most of all the resources are going to be in the parents' names. So that's why that's excluded. Because, it doesn't matter the household size. They may be saving money for a home, whatever. So we're just not going to count any of their resources. So the family's monthly countable income is considered when determining eligibility, which includes the income of the child applying, the income of the parents living in the same household as the child, and the income of the child's ineligible siblings living in the same household as the child. And countable income after exclusions must not be more than 100% of the federal poverty limit. So for 2024, that's $1,883. So I want to give a few examples of these living arrangements. Because we encounter a lot of different types of situations. I mean, everyone has their own situation, and that's how we look at this household size. So, little Johnny, his dad is deceased, and he draws RSDI off of his dad. He gets $500 a month. Little Johnny's mom, unfortunately, is incarcerated. So little Johnny is living with his aunt. His aunt is a doctor. She makes very good money, and she's worried that little Johnny won't be able to get the Medicaid living with her. So here's how we're going to look at that household. So the income of the child applying, little Johnny gets $500. So we're going to look at that $500. The income of the parents living in the same household as the child. Okay, neither one is living with the child. And the income of the child's ineligible siblings living in the same household as the child. Simply, an ineligible sibling is a sibling that is not eligible for Medicaid. So little Johnny doesn't have any brothers or sisters that live with him. So little Johnny's going to be a household of one because his aunt is not a parent. She is not in the nuclear household. So we don't care what his aunt makes. His aunt can make buku money. We don't care. We're only going to charge him $500 as far as the countable income.
What if the aunt has guardianship over him or is anything like that? Because we have a lot of families like that.
Yeah, they can have guardianship. That doesn't mean anything because that doesn't make the aunt the mother. Now, here's the problem. Little Johnny's mom decides that she's going to let the aunt adopt little Johnny because she can't do it. Now the aunt's income is going to be recounted because she has chosen to accept the role as mother by adopting the child. So the only way that a caregiver for a child that is not their parent is if they adopt the child. If they adopt the child, then that situation changes.
And it's sad that that adoptive parents are penalized for that.
It is, but it's just the way they count the parents living in the same household. For instance, little Johnny, his dad is dead. He's deceased. And his mother gets out of prison, so she's taking him back. They're living in the same house. Now, Johnny's mom has found Victor, and he's her boyfriend. They're not married, just boyfriend, okay? We're not going to count Victor's income. But little Johnny's mom reports a change that now she's married to Victor. So now we have to go back and we look at little Johnny's income, his mother's income, and his stepfather's income because they all live in the same household.
Oh my.
Yeah. This is why I'm saying there's so many different situations. Another one, and this is I'll touch on this later about the because there is something called ESI, employer sponsored insurance, We have lots of people that are divorced where child lives with mom, but dad carries the child on his insurance. Because mom and dad are divorced and little Johnny's not living with his dad, we can't count little Johnny's dad's insurance, even though it's court ordered, as employer sponsored insurance. If his mother doesn't have it for him, then and she's living in the household with him, then she could have to pay a premium. We're going to go to the next slide. So in addition to the gross earned income minus allowable exclusions are compared to the federal poverty limit, which is the SSI limit, when determining eligibility. Earned and unearned income are treated the same for MBIC. So where MBI, we had two separate categories that we looked at for the premium, the earned income and the unearned income. This one looks at earned and unearned as a whole. Now, just remember though, we can't deduct if mom is on RSDI and she's having to pay for her Part B premium and all that. We can't give exclusions for those. We have to count the gross income from Social Security, unless they have an overpayment or something that they're aware of. And so the MBIC allowable exclusions include the 85 plus 1/2 of the remaining income, and it's deducted at the end of the budget calculation. And the ineligible sibling exclusion, which I believe is at 3138. So as long as the sibling in the household isn't making a gross amount of 3138 a month, then their income isn't going to be counted. And I'll be honest, I don't know anyone that I've ever had that's made that much money as an ineligible sibling. They usually just work in a movie theater or fast food and they don't make that much. Next slide, please. So the monthly premiums for MBIC. Eligible individuals may have to pay a monthly premium as a condition of eligibility. The monthly premiums are based on the sliding scale, are calculated using gross countable family income, and are based on whether the applicant is covered under a parent's employer-sponsored health insurance plan and is eligible for the health insurance premium payment program HIP, and may range from $0 to $230. Next, please. So here's our sliding scale that we want to look at. So let's say Johnny's dad has insurance on him. He doesn't live in the home. Johnny's mother does. We can't count Johnny's dad's insurance because he's not living in the house, even though it's court ordered. They always try, well, it's court ordered. Well, that for us, that doesn't matter. So if she has no ESI and the family income limit is between these amounts. So a family of either one or two. So if little Johnny's living with his aunt, he's a family of one. And because his income would be below the 150 FPIL with the $500 that he gets from his dad's RSDI, he would have a 0 premium. And then it goes up for a family of 3 or more. And then it gives you the 100 to 51, 200 FPIL. And it's 90 for up to 2. 3 or more is 115. And then the 201 to 300 FPIL is 180. And 3 or more is 230. So ESI with state paid HIP. This is a premium chart. Let me explain how that works. When you apply for MBIC, and let's say little Johnny's mom does have employer sponsored insurance for little Johnny, her, and Victor. Okay, so she's got 3 people on her insurance policy. We verify it. What happens is when we complete that MBIC case and it's certified, there's an interface between us and HIP that automatically completes their HIP application and sends over for the client. Because the client has Medicaid, they're eligible to have their health insurance premium paid. So what HIP will do is they will run the numbers and look and see if it's worth it for the state of Texas to pay that premium for that household, or if it would, or if it would be less for the state if they just didn't pay a premium at all. Lots of times HIP picks up the family's premium, and when they pay the premium, they don't just pay for the MBIC child. They pay the premium for everyone on that insurance, everyone in the nuclear family. So, I mean, that's a real big plus for some of our families out there. It kind of gives them a break on, they're eligible for Medicaid, so it's giving them a break on having to pay that insurance premium. So what would happen is they would take the money out of the check for little Johnny's mom, and then she would send in a copy of her check stub showing where they took out, where she paid that month's premium, and then HIP would send her the payment for that in return.
Please remind us, what is ESI?
Employer sponsored insurance. ESI is, and it
Okay.
has to be for it, and it can be for the step parent in the house, as
Mhm.
long as it's a parent living in the household and they have the child on insurance. So no premiums are required for families with ESI and who are not eligible for HIP. So the families that do not qualify for HIP, they run the numbers. It's just not worth it for the state to pay their premium. They have a zero premium. That doesn't change. But if HIP starts paying their premium, then Maximus, who is our payment vendor, will send a notice to the client and let them know that they either have one of these monthly premiums. So if little Johnny's mom is paying $350 for her whole family to have insurance, her having to pay, $35, $70 is going to be nothing. And then if the child is also enrolled in, and this is a new one for me, help me, CSHCN, children with special health
Children
care
with special
needs.
health care needs. Yeah.
So children with special health care needs, if they are on that program and they have to pay a premium, it's automatically, it'll be paid for them. They'll pay us, they'll send in their premium payment, and then they'll be reimbursed by the HIP program, but it's through the Children with Special Health Care Needs program. So if a child is on that, good thing is even if they don't have ESI, their parent does not have that employer sponsored insurance, then they're not going to have to worry about it. They're going to pay the premium, but then they'll be reimbursed. Next slide, please. So MBI and MBIC offer all the same medical health care services like regular Medicaid offers, such as doctor clinic visits, hospital stays, emergency care, vision hearing screenings, prescriptions, glasses, speech therapy, occupational therapy, physical therapy, and mental health care. Next slide. Let me just also reiterate, MBI does not have any dental coverage. If the child is under the age of 18, they may have dental coverage with the MCO because we have Medicaid, dental Medicaid for children, just not adults. So to apply, an individual must submit a Form 1200 MBI or fill out Form 1200 MBIC to HHSC. On our website, we have both 1200 MBI and 1200 MBIC in English and Spanish. Or the application can be submitted online through yourtexasbenefits.com for MBI only. We cannot, at this time, MBIC is not an application that can be processed through yourtexasbenefits.com. They can do an application over the phone by calling 211, or they can mail it to us at the mailing address below. They can fax it into our document processing center, or they can come in any local office and turn it in. Just note that the MBIC application cannot be submitted online. Next slide, please. So after an application is received, HHSC has an eligibility determination within 45 days for applicants who already have their disability. They already have one through Social Security. Or they've had one. Maybe this is someone who is coming off of another program like MDCP or something. Maybe they don't meet the functional criteria for MDCP and they're going to MBIC. They would already have an established disability that we can honor. So we process an application within 90 days for applicants who do not have an established disability. Let me just give you a word to the wise. If you know you don't have a disability, start getting medical records. The quicker you get those in, the quicker we can send them in and the quicker we get them back. Right now, I'm really proud of our disability determination unit. We are getting our DDU responses back within a week. That's almost unheard of because just 6 months ago, they were almost a month and a half out. So I'm really proud of them for pushing so hard to get all those updated and everything so that we're not having to wait as long. I mean, it's, parents are nervous and upset, and I just don't want them to. I just hate that they have to wait. So I always tell my workers, you get the medical records, you send them in. I don't care if they don't have everything else, if they don't have a bank statement or they don't have proof of income. Let's get those disability determination units. Let's get those done first. That way, if they don't qualify, we can let them know. Or if DDU says, well, this isn't enough, but if we could get a 504 from the school showing this, this, and this, and that may be all they need. So, it's just the quicker you get in those those medical records, the quicker we can get them looked at and get that applicant's disability established. So HHSC will notify the applicant or the authorized representative, we call that the AR, of the eligibility determination. Eligible individuals may receive MBI or MBIC related forms. Next, please. So this first form is a form 0053. It's Medicaid buy-in potential eligibility notice. So what this notice does is we'll say that Rick has gotten approved. He has gotten his eligibility established. He's only potentially eligible because if he has a premium, we have to have that paid first before we can give him eligibility. So we're going to send this notice to the client and the AR if there is one. It'll have their benefit month. So what we do is, let's say he applied in January and we're in April. We, finally got everything done and we certify him this month in April. Okay. His ongoing month, because it's not cut off. Today is cut off. So we're going to get his case done today. So his benefit month at the top, starting there, would be May. And then it would go in reverse chronological order: May, April, March. So if he only pays one premium payment, he's going to get the ongoing month of May only. And he won't be able to get those other months again. But lots of the time, that's what the client wants. They just want to get on MBI. I know some people that are on Texas Home Living, if they have transitioned from SSI or something and they were denied and there's a gap period, sometimes they will want to pay those prior months so that they can get that. They don't have the Texas Home Living bills or any of those things associated with it. Or if they have, let's say he has a $50,000 medical bill from January and he only has a $25 premium. Well, it would be in his best interest to pay May, April, March, February, and January, which is 5 times 25, which is $125. So if he pays $125, he'll be able to get his $50,000 medical bill paid in the month of January. So for some people, that's a big deal. So on this form at the bottom, it gives them a due date and the total for all benefit periods. It explains to them in detail how, if they submit only 1 month's payment, it's going to be that first month listed. And then it's going to go in reverse chronological order. You can't skip months. You have to pay. So if you need January, you got to pay all the way back to January. Next slide, please. This is their 0051. We call this the MBI premium coupon. You'll notice at the top, it tells them, their name and their address. And then it says that your Medicaid premium for this month is $31. And then it goes on to explain, you have to make your payment by November, like in this one, it's November 20th. So the client has until the 20th of the month to send their premium payment in. If we don't receive it on the 1st of the month, we send them a notice. Next, please. We will send them a notice that says your benefits will end. So let's say they didn't pay their premium for uh, April. So April 1st gets here. April 2nd is usually we get our non-payment list. And so we send those out and we notify the clients and we let them know that if they have basically 2 days prior to cutoff to send in their payment or for us to receive that payment. If it's not received, they will be denied. And
Wow.
because they received the month of April, they will have to pay the premium for April before they could be recertified. So once they make their payment, so let's say, Rick paid his $125. This is the notice that we send to him telling him that he is now eligible. We'll tell him the benefit months. Those are the months he paid for in reverse chronological order. We'll tell him the action is that they are now approved. We will say who is included. We'll put the client's name and the premium amount paid. This is also a receipt. So, sometimes they get their, premium paid by someone else, outside of the agency altogether. And this is just basically a receipt that we received their payment. Next slide, please. This is an MBIC initial certification. This is for a child. Now, here's the thing. We never suspend a child's Medicaid unless it's in the prior months. So if little Johnny applies in March, we approve him in April, but he has a medical bill from January, little Johnny can pay April and March because those are his two. Well, I'm sorry. We approved him in April. He applied in March. So March and April, those are called optional. I'm sorry. Those are called the month of the application and the month that we decide on eligibility. Those 2 months do not have a premium. Those are automatically given to the child. Little Johnny doesn't have any bills in February, but he does have a hospital bill in January and nothing in December. Little Johnny doesn't have to pay for February. Little Johnny just has to pay for January, where he has his medical bill. So the only thing that little Johnny would have to do is he would be suspended for the month of January until all the premiums were paid. So in this instance, little Johnny's first premium payment period would be in May. So we would put his benefit period would be May, his name, the monthly payment, and then below that we would put February because we would put January because that's the month that he has that medical bill. And with the children, we don't have to go in reverse chronological order. We can go straight to the month they have the bill. And I really think, that they should do that for adults too, but they don't ask for my input. MBIC is it's like CMA. Texas does take care of their kids, or at least try to. Next. And then this would be a denial notice. This may be, sadly, we do have some children that pass away. And we have some children that their parents get better paying jobs, or for any other reason they're not eligible. Like one of the big ones is if your employer pays half of your family's premium. So if you work for the state of Texas pays half of my family's premium. So if I was to get on MBIC for my son, I would have to keep my insurance. I would not be able, like if we got on Medicaid, we're going to cancel it. The agreement with ESI, and that'll all be in their paperwork when they receive it. Plus, I try to discuss that with clients that are working and are getting those. My mind just went blank. Sorry. For those parents that do have them on insurance, I always try to explain to them, okay, now your employer doesn't pay half of the premium. You do not have to have your child on insurance. Then some of them, they don't have insurance at all. and we find out that they're on their 1028 MBIC, which is verification from their employer of their insurance benefits. And if the insurance benefit, they pay half of the family's premium, we would find out when the next open enrollment is. We would put that in the system. And then when the open enrollment comes, the system would automatically send them a letter telling them, hey, it's time to enroll your child in your insurance. Go ahead and send us proof that you've done that. And then we would go in and work that change. If the client does not send proof that they have enrolled their child, they'll get a denial form like this saying that the reason is because you did not adhere to the rules of employer-sponsored insurance. Next slide, please. I think we're almost done. So a request for information, we will, if you apply and we need any information from you, we will send a Form 1020. Most of the time for MBIC, we have to send that 1028 MBIC because the first page is so important with the employer's insurance information, hourly wage. That way, if, clients may be working overtime for a little bit, but then they don't, but adding that overtime makes them ineligible, we can go back to that 1028 and look, and where it says the client gets 40 hours a week at $15 and rarely gets overtime. So that's just, they got a little bit of overtime. It's just a fluke. So we can actually go back and move and make those payments match the 1028 MBIC for just 40 hours. And then the client, most of the time that helps, and the child is eligible. Next slide. That's our request for information. Next slide. This is the termination notice for MBIC. Next slide. The renewal process is after an individual is determined eligible for MBI or MBIC. Their eligibility must be redetermined at least once every 12 months. So the renewal forms are mailed to the recipient of the recipient's authorized representative at least 2 to 3 months prior to the renewal date. Must be completed and returned within 30 days. If not returned timely, benefits will be denied. There was just passed, I just want to share this with you because it's really important right now about MBIC. So if you want to listen good. Recently, the legislature passed a 12-month cert period for all children on Medicaid. So that includes MBIC. So if the parent, their cert date started 5/1, and then they get their redebt in March and they turn it in right away in March, and we see that they make too much money, I'm going to call mom and say, hey, you make too much money. But here's the thing. I have to keep your child on until May. So I have to hold this case until he gets his full 12 months. So if your income is lowered or you don't work as much overtime as you were working, we can reevaluate that in May. So that was a really good deal. That way, when people are returning those redeterminations early, it's actually going to be in their favor. Because then if we see they're not eligible, they have a couple of months to try to fix that. Lots of them, it's overtime. And they just cut back on their overtime. And that's it. But that's a really important legislation that was passed because it just became active 1/1/24. Renewal, we said, are mailed 2 to 3 months prior. They have 30 days to complete it. Actually, we won't deny them until their 12-month cert. So if they don't return it timely within that 30 days, it doesn't get denied due to this new law. So I probably need to go in there and change that. Next slide, please. So application tips when completing an application renewal form: answer all questions. If a question doesn't apply to you, indicate NA, because at least that tells us you read the question. Provide copies of bank statements, check stubs, Social Security award letters. You really don't even have to worry about these anymore because we interface directly with Social Security. I sometimes tell people you got awarded SSI before they even know they were. And then please remember to sign and date the form. We cannot take applications that are digitally signed in Word or Adobe, because even though, yes, it's a digitally certification signature, we don't know who signed it. we don't know who was in that computer and who did that. So we have to have wet signatures. And then return all requested information timely. Like I said, if they ask for something, the quicker you get it back, the quicker we'll get it worked. Next slide. And then anyone can assist an individual in completing application. It can be the applicant, the AR, or someone acting responsibly for the applicant. Most of the time, I have applicants that are quadriplegics, maybe, or something, and they're the person that helps them at home will usually fill it out for them. Next slide. And then again, we talk about somebody acting responsibly for the applicant, legal guardian, power of attorney, parent of a minor child, or other family member acting responsibly on the applicant's behalf. They can also designate an AR to act on all their agency matters. That way, honestly, that's kind of a little bit of a better thing, because not only do we send a notice to the client, but we send it to the AR. So if the client doesn't get that piece of mail, the AR might and maybe see, hey, did you see this? Did you get this in the mail? He or she may not have, but at least they'll know, and then it won't be a surprise if something happens with their case. Next slide, please. And again, we're just talking about the AR. Next slide. And then any additional information can be found in the MEPD handbook, Medicaid for the elderly and people with disabilities. And it gives you the link, and also Chapter M are the policy for MBI. Chapter N is in Nancy, is the policy for Medicaid buy-in for children. And again, the 1200 MBI and 1200 MBIC application forms can be found in the form section of this handbook. Again, both English and Spanish. Next slide. And then if you need to subscribe to the HHSC's website or through HHSC's Gov Delivery Service, there are the links. You'll enter your email and notification preference. And on the next page, under the subscription topics, roll down to meetings, news, and research, and select HHS eligibility policy handbook updates. I actually knew about this update for MBIC, having to have the full 12-month certification period before I even knew it at work. So that was pretty cool that they keep up with their Gov Delivery Service. So next slide. And that is it. Do I have any questions? I'm sure I do.
Yes, you do. And I realize, to everyone who is still listening, that this is a tremendous amount of information that is so complex, very confusing, so many little details. Lynn, if people have questions after this, how would you like them to reach out to you, or do they email us and then we forward the information to you, or how does that work?
Let me type in my email address.
Okay.
In the chat.
And Leonella, you can stop sharing if you'd like. To the person who signed in as iPad, could you please private message me the name that you registered with? I think you logged in after we got started. So to the person who is iPad, I just need to know what you signed in with. So the first question that we have is child support counted as income, or the death benefit received as a beneficiary?
So the death benefit received for a child is countable. Child support is also countable if it's current. If it's an active child support case and they're paying it currently. If the child's absent parent isn't paying any child support, we're not going to penalize the parent that the child lives with. Now, if they're paying child support from an arrears, that's only 1/3 of that is counted. So even if they're paying, let's say they're paying $200 in current child support every month, and then they have back pay that they're also having to pay of $150 a month. So we're going to only count that 200 current child support and 1/3 of the 150 in the previous for back child support. Now, if a parent says that they are, if the child is now an adult and the parent is giving that to the adult child, it's not countable. And the siblings in the household, unless that child support is $3,000 a month for them, their child support is not counted as well. So it's only going to be the applicant child whose child support is counted. So if there's 3 kids and it's $300, we're gonna be smart and divide that by 3.
So let me ask you a question to expand on that. So you just mentioned, if I understood you correctly, that if the child support is given, but the child is now an adult, which isn't uncommon because the disability is lifelong,
Right.
you're saying that's not counted?
It's not counted for the person that's receiving it. Like,
Right,
I have lots of people who their children are actually are going over into MBI.
right,
But what they're saying is, I'm giving all this child support, back payment child support to this child. I'm not keeping it. I'm giving it to my adult child. Then that's countable. That amount is countable. So like,
okay.
let's say, they're getting $95 a month. It's never, those arrear payments are never big. They're always small like that. And we really never have problems with them.
But if you have someone who is now, I don't know, 19 years old or 20 years old and still getting child support, that's not counted?
Well, when they turn age 19, I don't know about a child. Maybe you can answer that. Does a child with a disability qualify for child support after their 18th birthday?
They can if it's written in the decree, sure.
Okay. And see, that's another thing. That's when we would ask for your divorce decree. We would have legal look it over. And then with the child being, an adult, if the parent is getting the child support, they can say, "Oh, I'm not giving it to that child. I'm owed this because."
Exactly.
And then that's not, we don't even care because we're
That's
not even
right.
gonna.
Okay.
Yeah.
Got it.
Yeah.
Got it. Okay. Another great question. If a person has only Medicaid and no other insurance, has a major surgery, has no control over who provides all of the services in the hospital, will there be any out-of-pocket medical expenses?
Absolutely not. If the
Okay.
child is having if it's an emergency, you can't tell the ambulance to take you to the hospital on the other side of town that
Right, but
contracts.
what if it's not an emergency, but they have major surgery?
Now, if they're having major surgery, they would have to get, they would have to get those pre-authorizations.
Okay.
They would have to see Medicaid providers. Not in an emergency situation, you would just go to the nearest hospital. Medicaid understands that. But with like a surgery, a major surgery, you're actually, when you get on the MCO, I love now that we don't do TMHP, we do these MCOs, and they will give you a nurse that you can actually talk to. Let's say the procedure, they didn't give prior authorization. You could talk to your nurse and they can request the doctor who didn't approve the surgery to talk to the doctor that is requesting the surgery. They call that a peer-on-peer review. And before, we didn't have that. If you got denied, you just had to keep going to the doctor and submitting medical records until you got approved. But now we have it where the doctor and the requesting doctor can talk, and then they can come down to a decision. Usually it's just something like, okay, well, you need to try this first. And I think it may be like you have to walk in a boot for 2 weeks to see if it, heals, whatever. It may be something simple like that. But that's the good thing about having those managed care organizations, is they can talk to each other. They can talk to the doctor. They can be involved in your pay. It's a much more involved process with the care of the child or the adult.
Okay. Okay. Other questions for Lynn, and thank you for providing your email and your phone number. I am sure you will be getting phone calls and emails because this is very complex and it is so confusing, and you've been doing it for years. So we are elated to have you as a resource. Elated.
Judy, if
Thank
I may
you.
say, thank you, Lenicia, for giving us your phone number, but I think you put one more number there.
Hold on.
If you could
Let's
let
see.
us know which one is your
I'm
correct
sorry.
phone number.
Let me write
Yeah, I
down.
mean, it happens. Thank you so much.
To the person who is iPad, for some reason, I don't have you on my list, so I sent you a private message. If you could please give me your email and your cell phone number, that would be great, because I need to reach out to you. And you asked a great question. I know we were talking about Medicaid buy-in. Can I send you an email about SSI income limits? I always try to ask in office, and they do not want to explain to me how resources and income works. I'm making a little more money, so I want to know, because I think I'm not going to qualify for Medicaid anymore.
So, the SSI income limit is at $943. That doesn't change. It only changes every year with the COLA. That's a cost of living or adjustment that Social Security and VA do yearly. The resource limit is $2,000. And then if when you say you're making a little more money, so are you working? Because if you're working, then you could we have lots of clients that transition from SSI to MBI because, most of the time they're not losing their SSI because of the cost of a living adjustment each year. It's because they're actually working and they're making more money than the SSI limit. And like I said earlier, let me just reiterate, MBI and MBIC Medicaid are the same as regular Medicaid, same as your SSI Medicaid. It just does not have a cash benefit. That's the only difference. Texas Home Living, you have to come with Medicaid intact. So we always, we have a little fun when we call this is where you have to bring your own Medicaid. So if they get approved for MBI and MBIC, they can get on Texas Home Living. And that's what a lot of clients do. Or even they can, I don't know how that works with HCS, but they can get HCS services through because they already have the Medicaid intact. With the state of Texas, it just matters what pot the money comes out of.
Yeah, and in this case, it's for her son. She's the representative payee.
Mm-hmm. How old is her son?
Let's find out. And it's possible to the person asking this. I have a contact at Social Security that we can ask her that question. He's 12.
Okay. So if he's 12 and you're making too much money because you're working, we could look at getting him on MBIC.
Where they pay like $30 a month or whatever it is.
Right. Yeah, and if they don't have insurance, it's like $230 a month. But when you have a child that's disabled and you're going to the doctor every week, that's a drop in the hat.
Right.
So, but if you have any specific questions or situations that you want to ask me, again, email me or call me.
Yeah.
And if you can't get a hold of me, get a hold of Judy. She can always get a hold of me.
Absolutely. Yes, you betcha.
I saw on here where somebody.
Yeah, another
I wanted
question.
to say. Okay.
Go ahead.
I wanted to just say that I'm going to send you the MBI and the MBIC chart that we use for income and resources. That way, if anybody wants it, they can get it from you. Because I saw somebody ask about, what are the the income limits and stuff. So I want to make sure I provided y'all with that. That's public information. So yeah.
Yeah, because so often people say we're just over the limit. And that's so frustrating because they're not making a lot.
Right. And like I said, I mean, my workers, we try to
work
if we can, we try to see that, it's fair. And I mean, we're not going to just throw people off to throw them off. That's not what we're here to do.
Yeah, no, I gotcha. One last question. If the adult gets child support, can they get a court order to have it direct deposited to a special needs trust or to an ABLE account? And does it count?
The ABLE account, I don't think so, because I think it has to be, it had to come from your earnings. Now, for a special needs trust, I'm pretty sure that you can put any income in there, just as long as you're following the rules of the special need trust. But if you have a special needs trust, you set it up through an attorney. So you definitely should talk to that attorney
Mhm.
that set
Right.
it up.
Yeah.
I mean, yeah,
agree.
yeah, because we send all our trusts to our attorneys so that they
Mhm.
can interpret them for us.
Mhm.
So yeah, I mean, don't worry.
Okay. Thank you, Lynn, so much. Many thanks to all of you who joined us on this call. Please complete the survey. I realize it says, did you learn information to help you for your ARD meeting? That's because we have multiple grants that we are doing and we're trying to keep
Mhm.
our surveys simplified. So please go ahead and complete the survey. Lynn, if you could stay on after this
Okay.
presentation, that would be great. Many thanks to all of you who joined us today. We appreciate it. Please check our website for future trainings.
Thank you. Bye-bye.